Hi everybody, I'm Dr. Samir Ahire. I'm a board certified cosmetic and plastic surgeon and I do practice in Mumbai and Goa. I have more than 15 years of experience in cosmetic surgery, and in today's video I'm going to discuss regarding what are the risks, what are the complications, what are the side effects associated with tummy tuck surgery, because this is one among the common questions which my patient do ask when they do come for consultation, because they think cosmetic surgery you invariably ends up with some kind of side effects or complication. So let's start with today's video. So to begin with, any surgery has its potential problems. So if you are going to ask me the risk associated with this procedure, I'll tell you the risk is the same as what you have with a dental extraction procedure. The only thing here you need to understand is there are certain complications which do happen with every surgery or which can happen with any surgery, and there are certain complications, side effects or risk which are associated with tummy tuck surgery. To begin the common list, like for any general procedure, it depends upon what procedure you are doing, how much of surgery time it's going to be, the general anesthesia components, your health issues, whether you are already having any comorbid condition or risk factor which is going to increase the risk of complications. And plus to that, like any surgery can have swelling, can have infection, can have wound healing issues, can have bleeding. So these are what we say the common kind of complications or common problems which are associated with any major surgery. To be specific to tummy tuck surgery, let's start by enlisting what all things you can expect. Before coming to the point of enlisting the various things, problems associated with tummy tuck surgery, we as a surgeon always believe in one thing. Definitely risk, complications, side effects can happen with any procedure, but you should be able to tackle it. The way in which I do tackle all these problems is pre-operatively I give you good antibacterial washes. I put you on pre-operative antibiotic. I give you good amount of intra-operative antibiotic. Post-op also you are on antibiotic medications. Your dressings are sterile. The way in which we do handle our patients, we take care of all the sterile precautions. So this is what we can do to prevent any kind of problems which is associated with tummy tuck surgery. The most common problem associated with tummy tuck surgery is first is the scar. So definitely you can expect your scar to heal well, but then Indian patients are known to have a scar, but the way in which we do, we keep the scar very low, that is hidden in your bikini line. Sometimes there is kind of a French bikini in which there is high lateral tension tummy tuck, in which the scar on your hips is pretty much high, but I personally try to keep your scar hidden in your bikini. I try to give you a very low bikini scar. Plus to that, I'm very aggressive in the scar management. In that sense, I give you all kind of glues, I give you all kinds of dressing materials, the best dressing materials. Plus to that, I put you on a very strict scar management for next 3 months from the day of your procedure. So this is what you can expect with me. The second thing, the patient most commonly complained are dog ears. After the surgery, you must have seen many patients, they have bulging at the end of their scar. So that is the dog ear. Usually that happens because of inadequate excision from that area, or surgeon is unwilling to go beyond his incision markings to get rid of the dog ear. But then dog ear option, the treatment for dog ear is only one, which is a surgical excision. Third thing comes related to tummy tuck surgery is when we are going to take a cut. We are going to take such a big cut. All your nerves which will be traveling upwards are going to get cut. So you might have little bit of impaired sensation on your, particularly on your lower tummy, for some time, somewhere around 3 to 6 months from the day of your procedure. That usually recovers completely 3-6 months down the line. It is almost 100% normal to back to the normal what you had before the procedure. The fourth most common issue associated with tummy tuck surgery is the scarring around your navel. Some patients have little bit of hypertrophic scarring or keloid in that area, so that doesn't look good. But then there are many options available to it, and we are able to revise it very easily. The next thing which comes is a kind of a wound gape. Wound gape can be a very minor thing which can be managed with dressings, or most often they don't need any kind of dressings, or it can be severe enough in which we have to actually open your abdomen again, clean the area, and then stitches again. So it varies, but usually the way in which we do the procedure, we have never found any of our patients have never got this kind of wound infection. Yes, wound gape, kind of which needs some revision surgery can be a possibility, but then wound getting infected and you are having skin necrosis is a very rare occurrence with us. Most of these problems or complications which I have told you are the minor complications which do heal by itself over a period of time. There are certain things like major complications, for example, in 1 to 5% of the patients, in which they need some kind of active treatment, or you need to be vigilant, or you need to get readmitted for that. To enlist a few are a kind of a fat necrosis, in which you have because your abdominal flap is going to have fat in it, so it might necrose because of the exposure. You might have discharge, so in this scenario you might need some kind of active management. If since it's a major surgery, it's a 3-4 hour procedure, and you are having any risk, you might end up with embolism or DVT, so this can also be a possibility. Very commonly, sometimes what we see is a kind of a seroma, in which either your drains are not draining, or you have kept the drain for a little bit shorter duration, so there is not adequate drainage, and some fluid might collect inside your abdomen, which might absorb on its own, or which will have to be drained. So this is in short regarding all the side effects, risk, complications associated with tummy tuck surgery. And at the end, I'd like to tell you, whatever things I have enlisted, these are very rare occurrences, and the results what you get after a tummy tuck surgery is nothing to be compared with all these small things. But as a patient, you should know what all things you can expect, and you should be ready for the minor as well as the most dreaded complication. So if you are thinking of getting a tummy tuck surgery done, like this video, subscribe to your channel, because you will be getting a list of all the videos related to tummy tuck surgery. And if you are having any queries, questions regarding tummy tuck surgery, put it in the comment box, or DM us, or put it in our Instagram handle. My team will be more than happy to help you out. Thank you.